Yeah, and we've already, we got them divided and announced that, so. So let's just work by saying.
What else has happened in the last? Okay. Good afternoon, everybody. Again, I'm Pete Meitzner, currently the chair of the Sedgwick County Commission. Just a reminder that even under the current order, if you've got enough social distance and you're speaking, you can not have to have the mask on for clarity. So all of our speakers will either be masked or not masked, depending on their choice. So today, January 28th, just to preface this, we discussed, if you all recall, 6-7 months ago when testing was a really important thing in our community, and there was a lot of information and misinformation out there. And so we went to some daily and maybe every other day press conferences to help clear the air with the message that was best and most consistent with Sedgwick County. So with the help of that discussion and Commissioner Cruz thought that we've been having a lot of misinformation and confusing information about vaccinating, so we are intending to start these back up until we get a firm handle on it, and the community is happy with that. So again, I'll start out by saying we continue to have received trickles of vaccinations and supplies in our county from KDHE. We want to get these vaccines to our residents in a thoughtful and expedient manner, most especially into the arms of the most vulnerable, which is our aged population. At this time, our top priority are 65 and older residents and those working in our medical community. And right now, however, we are only able to vaccinate residents age 80 and older, along with our medical workers. We are in communication with our state leaders daily to understand where we stand as a county with the vaccination pipeline. Therefore, today, We have our local health officer, Dr. Menz, and our Deputy County Commissioner, Tim Kaufman, to walk through some supply and demand logistics related to getting and delivery of the vaccine. And Dr. Menz will explain why we have made older adults our priority in Sedgwick County and emphasize the medical importance of receiving the vaccines. So with that, I will introduce Tim Kaufman regarding supply and demand logistics. So Tim, thank you.
Thank you, Chairman. Good afternoon. I'd like to take this time to provide you with a process overview, how information is shared with Sedgwick County, and how the COVID-19 vaccine is allocated to us. Once the vaccine has received its emergency use authorization from the FDA, it is ready for public use. On a weekly basis, the CDC lets states know how much vaccine is available for that state to order. Kansas creates an allocation plan, orders the vaccine through the manufacturer, and then places that order. The vaccine is shipped to the county directly from the manufacturer. We know that the state of Kansas is about 1% of the country's population, and currently the allocation that we've received is about 1% of the vaccine available. Doses are allocated to the county, and they're divided up amongst various approved vaccine providers. We've known for several months that the vaccine rollout would be slow-moving due to the limited quantities of vaccine available. And as manufacturers are able to increase what is available, we will continue to vaccinate more and more people. Now I'd like to offer an opportunity for Dr. Menz, our local health officer, to talk about the planning that's gone into this process up to this point.
Thank you, Tim, and good afternoon to everyone. At the beginning of the vaccine rollout, the KDHE established guidelines for who would receive the vaccine. Sedgwick County has decided to follow these guidelines. The vaccine rollout was developed to ensure that healthcare workers and those who are in direct contact with COVID-19 patients would be able to receive the vaccine first. This was phase 1. Several weeks ago, Dr. Lee Norman at KDH&E gave counties permission to determine priorities as the state moved into vaccination phase 2. A team of local medical experts and I met to review and discuss the populations included in phase 2. Based on our conversation and the local hospital situation, I decided that Sedgwick County would first focus on vaccinating persons 65 years and older. However, we do not have 110,000 doses to share with all residents aged 65 and older, so we are working our way down in age as we receive more vaccine. We know that when older people contract COVID-19, they are likely to have serious complications. They are generally more likely to become hospitalized and perhaps even pass away from the disease. We know that residents aged 65 and older are more likely to become hospitalized from COVID-19. This age group has also had the highest number of hospitalizations in Sedgwick County. We also know that 77% of our county residents who have passed away from COVID-19 are over the age of 70. Our hospitals are still at a critical capacity, so I do believe that by focusing on the most vulnerable, we work to reduce our hospital admissions. I'd also like to take this time and reiterate how important it is to get the vaccine once you are eligible. The vaccine schedule is a marathon and not a sprint. It is dependent on vaccine supply and the allocations we receive from the state and the vaccine manufacturers. Rest assured that everyone who would like to take the vaccine will be able to receive the vaccine as it becomes more widely available. These vaccines have gone through rigorous clinical trials and analysis and have received FDA approval. They are safe and effective, but only effective if you receive both doses. The second dose, in some sense, is the most important, as receiving a second dose boosts your immunity up to 95 to 98% effectiveness. And along with those doses, it is critical that you keep your vaccine card. This card, which you can show, is another indication that you continue to do what you can to reduce the spread of COVID-19 in our community. In the future, I imagine will be our ticket to opening our economy back to its previous state. But we also know that vaccine is a new tool in our community's toolbox to fight COVID-19. In order for us to get to a place where we can even consider opening up our community entirely, we must continue to use the tools in our toolbox to keep each of us safe and healthy. Namely, wear a mask or face covering, wash your hands often, watch your distance, and try to keep a 6-foot space between you and people not in your household. And I'd like to remind everyone that we must continue to follow these behaviors, especially wearing a mask, even after receiving the COVID-19 vaccine. Even after we received the vaccine, there are still many people in our population who have not received it yet. We are in this together, and we will get through this together. Tim, now I'd like to hand the microphone back to you.
Thank you, Dr. Menz. Now I'd like to share some good news that we've received from KDHE. They've informed us that our health department should begin to receive a regular weekly shipment from the state's allocation. Next week, we anticipate receiving 7,000 Pfizer doses. It's our understanding that we can plan on receiving 7,000 doses weekly for the foreseeable future. Based on this information, we are now accepting appointments for residents age 80 and older to receive the vaccine. We are also happy to announce that we've partnered with the Wichita Transit System, and we will offer a drive-through vaccine clinic for this age group if they have mobility issues at the Transit Operations Center at 777 East Waterman. This is not the bus station on South Topeka. This drive-through clinic will begin on Monday, February 1st, and all of the vaccination opportunities that we talk about are by appointment only. Monday, we will be back at Intrust Bank Arena to vaccinate healthcare workers. We will also have appointments this weekend at East 9th, the Health Department location, Friday and Saturday, January 29th and 30th. To reiterate, we will be at East 9th on Friday and Saturday, so if you have an appointment for this Friday or this Saturday, please go to the Health Department on East 9th Street. Then on Monday, we'll begin again at Intrust Bank Arena and at the Wichita Transit Operations Center. As we become more confident that we have reached a majority of each age group in the age 65 and older category, Sedgwick County will begin to open appointments to additional categories within Phase 2. Please note, as we open appointments, we only schedule for vaccine that we have on hand to dispense. We do not schedule appointments, nor do we have a waiting list for vaccine that is not in our possession. Due to the limited supply of vaccine, we're only scheduling appointments for people who live in Sedgwick County. Our primary focus is on our residents. We know that Dr. Norman stated that Kansas residents may go to other counties to receive their vaccinations. However, Sedgwick County has made the decision that to offer these vaccinations only to our residents or to healthcare associated workers that work here. Dr. Norman also allowed counties the autonomy to make their own decisions about how to vaccinate residents in a manner that best suits their county. Moving forward, we will continue to use all communication platforms available to us to keep residents aware of the changes in our local vaccination capabilities. Who can get vaccinated and where? Currently, we're using Intrust Bank Arena as our main vaccination clinic, and we appreciate their partnership, but we're also exploring other locations to house our vaccine clinic long-term. If there are any changes, we will notify you. So now that we've stressed the importance of getting the vaccine, let's learn how to schedule an appointment for a vaccination through the health department. Kate, could you please walk us through that process?
Absolutely. Okay, I need the keyboard would be helpful. Okay. So our main platform for scheduling appointments is online through the Sedgwick County website. You'll notice here on our homepage, sedgwickcounty.org, we have a banner, and it's now vaccinating residents age 80 and older and healthcare associated workers. It's easy, you just click on the banner, and it'll take you to this page here where you can schedule a vaccination. Pick dose 1, your first shot, or dose 2 if you need your second shot. So let's say I'm an 80-year-old and I need dose 1. I'll click here. If I am unable to schedule an appointment online, we do have a phone option to schedule an appointment. That is 660-1029. And so you can schedule your appointment over the phone if you do not have access to schedule it online. Here we have the criteria for, once again, vaccinating residents. And again, I confirm, yes, I am age 80 or older. So here we have instructions on how to schedule your appointment, clarification like what we just mentioned this afternoon about getting the appointments in, and we're only scheduling appointments for vaccines we have on hand. Additional instructions, and then also information on the Moderna or the Pfizer schedule based on whichever your dose is for your second dose. But here we have our registration page. We have, like Tim said, the ability to offer walk-in vaccines or drive-through vaccines. So let's say I'm a very active 80-year-old, so I'm going to click walk-in. And here we have appointments ready to go for Monday, Tuesday, Wednesday, and additional times later in the week, next week. Sure, let's go on my noon hour. So I think 12:15 sounds like a pretty good time, Monday over the noon hour, to get my first shot of the vaccine. So I click to 12:15 and click continue. Here is where you fill out your information. And please note that if you're a caregiver or an adult child of somebody who's 80 years old or older, you can fill this information out for your loved one. So I'm going to fill it out as me. And typing in my phone number, 9370, and my email, kate.flavin@sedgwick.gov. And then how old will you be on the date of your appointment? So this, again, clarifies that you are 80 years old or older. So we're going to say I'm 83 years old because that sounds like a good age to be. Do you understand that you may be turned away if you cannot offer proof of your age? So this, again, reiterates, please bring your driver's license or any sort of identification, a birth certificate that shows your date of birth to confirm your age. So yes, I understand that. Yes, I understand that the appointment is for walk-ins only, so I do not, I'm not able to drive in and get the vaccine, but I have to walk inside of the building. And then yes, I live in Sedgwick County. I've been a lifelong resident. So I click yes there. And then we complete our appointment. And here we have our appointment. It's scheduled, it's on the calendar, and then I received an email notification confirming that as well. That's all you need to do for your appointment, and you are scheduled. Before you go to the appointment, however, we also want to make sure that you go through the Dispense Assist form, and so we'll make sure to have that available. It'll be in the email that you receive to fill out and complete before the appointment, or you can also complete it at the vaccine clinic. So that is a quick and easy way to schedule your appointment online. And once again, if you don't have the opportunity to schedule your appointment online, please dial 660-1029 to schedule that appointment.
So thank you, Kate, for that. As we wrap up today, I just want to say thank you for tuning in. We appreciate your interest in this process, and we hope that with all the media here, they will help us communicate our message to the community. Here at Sedgwick County, we plan to continue vaccinating residents as soon as we are able. That is our number one message. As previously mentioned by my colleagues, Sedgwick County is focusing first on vaccinating residents in Phase 2, aged 65 and older, because we know that they are more likely to experience serious complications if they get COVID-19. And they're generally more likely to become hospitalized. Reaching all residents in this age group will take time. But I'm encouraged by this process, and I'm encouraged by our partners in the media that will help us communicate this message. Last Wednesday, we began Phase 2 with residents aged 90 and older, and just one day later, we expanded appointments to residents aged 83 and older. Today, as you can see, we're expanding to residents 80 and older. We will continue to expand availability as more vaccines become available. These decisions are being made by a team of people who are thoughtfully looking at at all the data available to us. I want to reiterate that due to the limited supply of vaccine, we are only scheduling appointments for people who are current residents of Sedgwick County. Please follow your home county's vaccine schedule should you reside outside of Sedgwick County. Again, we are committed to communicating what we know to the citizens of our community, and we look for your help, our media partners. We look for you to help us communicate that and communicate it correctly. As we receive more vaccines, your Sedgwick County Health Department will vaccinate more people while following the guidance of CDC, KDHE, Dr. Menz, and the physicians in our community. The vaccination schedule is designed to ensure that all who want to be vaccinated will have that opportunity. Please continue to check our website, watch the news, follow Sedgwick County government on social media, and stay tuned for updates. Lastly, we're asking for your patience. We're asking for your kindness to each other and the continuation of our health and healthy behaviors as we continue to work to protect our friends, our families, our neighbors from COVID-19. We will get through this together. And with that, I'll open it up to questions from anybody who might have one. Want to join me? Come on, you guys got questions.
I guess this is probably for Dr. Menz. You mentioned a vaccination card. Explain how that works, what kind of information is on there, how that's, who's providing that, and that sort of thing.
When you report for your vaccination, they will give you a little card that told you what brand of vaccine you got, and I think it also has the date that you should be getting your second dose on it.
Will that be signed by an attending medical personnel there? How does,
I don't think it's signed by any medical personnel, but it's got the county health department notification on it and all that.
Will the county get a copy of these?
Well, the county, when you register, they know you're there, and they give you that card to show you and to remind you when you're to come back for your second dose.
Will they receive updates on who has received the vaccine?
Well, who receive updates?
Once the card is filled out, will any of that information be relayed back to the county?
Well, it's based on the information the county collected from you when you registered, and it's just proof that you got it, and now here's your second date.
Do we have any updates on where we're at as a county on long-term care facilities? I know there's the federal partnerships covering some. The county's supposed to cover the ones that aren't signed up for that. Do we happen to know where we are percentage-wise or status-wise?
I don't have that information with me today. We'll see if we can't get that information and share it.
I know many of you have said that you want to move forward, but you just don't have the supply right now. So how vitally important is it for the federal government to give the vaccines to our county, to our state, to be able to vaccinate those who are being hurt the worst?
Well, if we don't have vaccines, we can't vaccinate. So it's vitally important for the federal government to administer those in a timely manner. And I do believe that we're going to see that. I have to have faith that we're going to see that it's going to start trickling down in a more strategic manner.
If I can add to that, we're all in various communications with KDHE, with the governor's office, even our state elected officials, and so everybody's trying to get the boat rowing in the same direction. But my recent discussion, I understand that the state now, there's a new administration at the president level, and the states are working with the new administration, and there's a goal to have a more advanced notice of how many you're going to get and when. It's been a kind of a really difficult time. We get a call on a Tuesday that, hey, on Thursday you're going to get so many, and that's been the way. And the state's been the same. They don't know when they were going to get them, how many, and so I think there's going to be some disciplined advance notice so people can plan. I don't know how much advance it's going to be, but that's a serious goal that will help alleviate. And the state gets their notice on a rolling week in advance, and then they can in turn share that with the counties. So hopefully there'll be a little more coordination with that. Long answer to your question, but
I might add that there are currently 2 vaccines approved by the FDA. They're very similar in their effectiveness. Those companies that are making those are manufacturing as fast as they can, but there's a global demand for these vaccines. It's not just our country, so they are really working hard. However, there are 2 other companies that are in the final stages of their studies on their vaccine, and we are anticipating they are likely to be approved in the next month or 2. Once those 2 companies are approved, we will have then more vaccine coming, because now we will have 4 different vaccines available, and there's even a few more in the pipeline. So it's looking good that in the future months we will have more vaccine available.
Have we been having some issues like we have in the past in the state with reporting? Does Sedgwick County have any issues with that with the KDHE?
Well, I would say we're focusing now on what we know in Sedgwick County to report on Sedgwick County, because there is a reporting lag. CDC says this one, and the state has us distributing so many, and we know that in most cases we've done a lot more than that, and so there's just a lag of timing. But Tim, you can elaborate.
From the county's perspective, we've been doing vaccinations of all sorts for many, many years, and so we're very familiar with and comfortable with the state reporting system. There have been other entities that have been dispensing vaccination this time that maybe haven't been as familiar with the reporting tools, and so that has contributed to some of that lag. The county is current with our data entry to show the vaccines that we've delivered.
Quick logistics question here. On the 7,000 a week distribution, the 7,000 a week, is that total doses, or are those all first doses, or will some of those be used for second doses?
Our intent now is to use those as first doses, and what we're encouraged by is this idea that we'll see a regular shipment and allotment, and then we'll start to split that out between first doses and second doses.
Okay, well, if there's no other questions.
Did you guys have a total number of vaccines that they've got already? Did you already say that? Maybe I missed it.
What is it?
Total vaccines as we've administered today,
And just total altogether, like?
it was around 11,000
I-
doses that we've given.
I think we're over 12,000 now. Again, we can get that
But
information out
that's,
through Kate.
and that's also, put an asterisk on there, because the hospitals, Wesley and Via Christi, they've vaccinated all their employees with their own supply that came direct from the feds, related to the care homes. They're getting vaccinated directly from the feds. So the 12,000 number that we're talking today is just what we know of Sedgwick County, but we know that there's much more, maybe double that, I would guess.
Can you clarify whether that's doses or people? Because that's a good clarification to make.
What we're going to report is going to be information on doses, because some of those folks we have now vaccinated individuals twice with the first and second dose, and so we'll continue to report doses.
All right, any other questions?
Okay, well, thank you all again, and we'll try to figure out how often we want to do this, at least weekly, maybe a couple times a week, and because things, if you've seen, have changed. We went from 90 to 83 to 80 in a matter of 8 days. So stuff is happening quickly, and as we get more information that's vital, we want to share it, and appreciate your cooperation with sharing this information. Thank you. If we do a little more regularity with these, we don't necessarily need